Longer to heal for someone who has diabetes, and unfortunately for some, the only treatment option is amputation.
Tonight, Channel 5's Angela Vargas takes a look at what happens after a person loses all or part of a limb to amputation.
Diabetes is a cause of me having renal failure and the amputated foot or leg.
Duvina Avila says she had a wound on her leg for 2 years. The wound wouldn't heal. She couldn't stand the pain.
To me, having the amputation, I like it better for the fact that I don't have to go through any infections or any problems with the leg.
It didn't take long for Avila to get back on her feet.
I got depressed one day. I didn't want to do nothing. I was just laying in bed. And something just went over me and told me, get up and go.
Avila says her motivation came in the form of a child, her daughter.
I have an 8-year-old. I cannot be sitting down and see her life go by without me being involved.
Avila, like many others across the valley, were directed to get a prosthetic.
Generally what we do is we do an eval and we try to find out where you've been, where you want to go, what activities that you were doing prior to the amputation.
Certified prosthetist Anthony Inman and his team produced the prosthetics. Most of their patients have diabetes.
Majority of them are diabetic. Probably between 92 to 95% are diabetic. We see more and more diabetics every day. Daily. So we have the ramp.
Inman tells us he was forced to expand his business.
A main reason for the expansion is to better facilitate the patients that we see from rehab.
A patient of Inman stepped forward to help other amputees.
It was an adjustment at first because you lose a part of you. It's like a death in the family.
Elizabeth Reynoso was diagnosed with diabetes 21 years ago. An infection in her foot forced doctors to amputate.
Within 24 hours, the doctor came and he says, I have to amputate. And I told him, well, can't you give me time to think about it? He says, no, my organs were shutting down.
Reynoso found a new purpose in her journey through life. She created the Valley's first amputee coalition.
There had never been anything for amputees down here in the Valley. We have that now. We started meeting every Wednesday of every month. And so that's free for anybody that wants to come in and learn more about amputation.
We make a positive mold out of it.
Inman believes diabetes will be a problem for a long time. His patients want others not to give up.
Don't be afraid to take the chance, because if you don't take the chance, you're always going to be stuck like in a bubble. You won't be able to go anywhere.
Avila and Reynoso say they will take advantage of their second chance to walk and live their lives. They see prosthetics as a way to get back on track. Angela Vargas, Channel 5 News, McAllen.